Ladies and gentlemen, good morning and welcome to the QAPI for Home Health Agencies Part 2 conference call. Your host today is Andrea. Andrea, please go ahead.
Hi, good afternoon or good morning, everyone, and welcome to today's webinar presented by the Lake Superior Quality Innovation Network. And welcome back to those of you who joined us for Part 1 last week. Again, my name is Andrea Lahoff. I'm a clinical quality consultant here at MPRO. Just really quick, if you would like a copy of today's slides, you can visit the QualityNet event page and enter the password HHAQAPI. That's all caps and no spaces in the event materials section, and I will make sure I put a link of that into the chat. And I'm also joined here by my colleague, Mark Lausch. Mark's a certified advanced alcohol and drug counselor and licensed master social worker, and he's also a clinical quality consultant here at MPRO. So I'll turn it over to Mark.
Thanks, Andrea. Hey, good morning or afternoon, everyone, and glad you're back for Part 2 of QAPI for Home Health Agencies. Really nice to be with you today. I'm going to look over the objectives for today's presentation, our Part 2, and today's objectives are to describe the action steps to developing a QAPI plan, develop a cardiovascular QAPI plan using key tools from the Cardiovascular Health Best Practice Intervention Packages, or BPIPs, and then we want you to evaluate the cardiovascular QAPI plan using the Home Health Cardiovascular Data Registry, or the HHCDR. Okay, for the purposes of review, let's take just for a moment here and review some of the material we covered in last week's webinar. As you may remember, there are 5 standards of home health QAPI, or quality assurance performance improvement, and these are executive responsibility, program scope, program data, program activities, and performance improvement projects, or PIPs. Let's just take a minute now to, again, look at review the QAPI action steps that we discussed last week. First, it's important to have a top-down leadership responsibility for your QAPI plan. Governance such as board of directors and leadership must buy into the plan in order to instill commitment from all staff. Second, your agency should develop an approach to teamwork that encompasses all levels of the agency, from the receptionist to the clinicians in the field, to the supervisors, and to the leaders. Third, using the QAPI Self-Assessment that was provided to you last week will allow you to evaluate the extent to which the components of QAPI are already in place and identify those which require further development, hence the name self-assessment. And finally, establishing a purpose and guiding principle will help you unify the agency by tying the work you will be doing to a fundamental purpose or philosophy. So remember, vision, mission, guiding principles. Most of you already have completed at least this part of the QAPI plan in terms of having a vision and mission for your organization, because most of you probably found that in your policy and procedures manual or some of your agency materials. Okay, we're going to put up a polling question, actually 2 polling questions now. That should pop up on your screen momentarily. And the first question is, have you or do you have plans to conduct your QAPI self-assessment? If so, did you do the QAPI self-assessment that we provided to you last week, or do you have plans to do it? And second, have you located or identified your organization's guiding principle? So if you can take time to answer those 2 questions, we will see the results of those in just a moment. Again, I don't have Jeopardy music for you. So awkward silence, right? I think they're going to leave it open for 45 seconds, and then we can look at the results on the screen. Like I said before, I think the organization's guiding principles are relatively easy to find, and I imagine that most of you will not have to develop those independently. They will probably be, at least the mission and vision should be there. The guiding principles for the QAPI plan you probably would have to put together unless you have one already in place. Okay, so our polling results, have you plans to conduct or have you done your QAPI Self-Assessment? And it looks like 11 out of 25 said yes, and have you located your organization's guiding principles? The same thing, 11 out of 25 said yes. Only one person answered no, and the rest of you weren't able to answer. So we can go ahead and move on. Okay, now it's time to develop your QAPI plan. So your plan will assist you in achieving what you have identified as the purpose, guiding principles, and scope of your QAPI plan. This is a living document that you may revisit as your facility evolves. So it's not a one-time thing. The QAPI plan is going to grow and evolve and change as you move forward and start to address issues and problems in your agency. A written QAPI plan guides your agency's quality efforts. So it serves as the main document to support implementation of your QAPI plan. Again, it describes the guiding principles that will be used in QAPI as well as the scope of your plan, and it's based on the unique characteristics and services of your particular agency. So you may use the guide for developing a QAPI plan to help you create a comprehensive plan that addresses the full range and scope of the care and services provided by your organization. Okay, so let's talk about developing a QAPI awareness campaign. This process includes first communicating with all staff. You need to let everyone know about your QAPI plan, often and in multiple ways. So communication, very important. If you have newsletters, if you have staff meetings, if you have huddle, things like that, to communicate your QAPI plan, or at this point that you're developing a QAPI plan and you're seeking input. Plan ongoing education beyond single exposures, right? The goal is widespread awareness of your QAPI initiative. So a single kind of hit one time and move on is not going to be successful. Train through dialogue examples and exercises. You can take larger material or larger ideas and break them into smaller pieces and easily understood concepts. So you can use your agency's own experience as part of the learning material. So yeah, case studies, things like that are important too, or looking at issues that occur in the agency. Convey the message that QAPI is about systems of care, management practices, and business practices, and that your system should support quality and acceptable business practices, or they must change. Use examples to get the message across, and ask staff to think of examples of their own. Again, getting in buy-in from all staff levels. Be sure any consultants, contractors, or collaborating agencies are also aware of your QAPI plan, because they do have a role in your system. And discuss the hard questions. What is meant by a culture of safety? These types of questions often do not have easy answers, but QAPI and the QAPI process opens up these types of issues for discussion and deeper thinking amongst your staff. Okay, next step is to develop a strategy for collecting and using QAPI data. So your team will decide what data to monitor routinely. You can use the HHAs cardiovascular data registry for this. But the data will require systematic organization and interpretation in order to provide, meaningful results in action. Otherwise, it may not be useful. Your team should set targets for performance in the areas that you are monitoring. A target is a goal, usually stated as a percentage. In other cases, you may have both short and long-term goals. For example, your immediate goal may be reducing unplanned rehospitalizations by 15%, and then subsequently by an additional 10%. So think of your agency as an athlete or performer who keeps, trying to beat his or her own record, get better over time. Identifying benchmarks for performance is an essential component of using data effectively with QAPI. So a benchmark is a standard of comparison. So you can look at your performance compared to home health agencies in your state and nationally using Home Health Compare. But generally, because every agency is unique, the most important benchmarks are often based on your own performance. So for example, seeking to improve hand washing compliance to 90% in 3 months based upon a finding of 66% in the prior quarter. So you would obviously look to achieve 90%. After achieving the 90% mark for a period of time, the benchmark can be raised higher as part of ongoing continuous improvement. So you'll want to develop a plan for the data you collect. Determine who reviews certain data and how often. Your QAPI committee could be a good place to do this activity. Collecting information is not helpful unless it is actually used. So be purposeful about who should review certain data and how often, and about the next steps in interpreting the information. Okay, after you have developed your data strategies, you'll then identify gaps and opportunities. Okay, this step involves reviewing your sources of information to determine if gaps or patterns exist in your systems of care that could result in quality problems. Or are there opportunities to make improvements? This is where you identify the areas that you might want, you might want to work in or identify a performance improvement or PIP to address. Some potential areas to consider when reviewing your data. Home health compare. Some potential areas to consider when reviewing data are home health compare, which provides quality information about every certified home health agency in the country. You can look at patterns of ED use or hospital utilization or readmission. And during this step, you might decide to spend more time discussing the quality themes you have identified. This may show you patterns you have not yet identified and may help bring about what is at the root of a problem. This next step should lead to your performance improvement plans or PIPs. So once you've identified the data, you've developed your data strategy, you've identified the data, you've looked at some potential areas data areas to review, you would then look at developing performance improvement plans or PIPs. These projects are expected to be chosen to deal with high-risk, high-volume, problem-prone areas. So that's a key concept there, the high-risk, high-volume, problem-prone areas. So you want to start with the areas that I think command the most attention. But take time to notice the things you're doing well too, and that's what this process is going to show you also by looking at your processes and systems of care. It'll tell you some of the things you're doing well too, which is a good thing. And then, you need to kind of give yourself a pat on the back in certain areas that you're doing well in. But while you are celebrating accomplishments, you can also begin to set priorities for improvement around the issues that the team identifies. Okay, so now we're going to talk about prioritizing opportunities and chartering performance improvement plans or PIPs. So, prioritizing opportunities for improvement is a key step in the process of translating data into action. As you continue to implement your QAPI plan, you and your team will prioritize opportunities for more intensive improvement work. Problems versus opportunities are a matter of perspective and often require discussion. So it may take significant discussion amongst your QAPI team to decide what areas need more intensive improvement work. Choose problems or issues that you consider important. Again, high risk, high frequency, or problem-prone areas are the ones that might command attention first. And consider which problems will become the focus of a PIP. All identified problems need attention, but they do not all require PIPs. Okay, so you don't have to do a performance improvement project for every problem that you've identified in your QAPI plan. Sometimes those solutions to those can take place just through small process improvements, accomplishments, or something along those lines where you see a problem, you can address it right away and develop processes or plans to address it where you don't need a performance improvement program. Begin some PIPs with problems you think you can solve relatively easy, because a quick win is worthwhile. It gives the team some momentum for moving forward. It's a good team building experience, and it's good to start with a quick win. So, in chartering PIP teams, we use the word charter on purpose because a performance improvement plan is more than a casual effort. Okay, it entails a specific written mission to look into a problem area. So the PIP team should include people in a position to explore the problem. If those persons are not already on your QAPI committee or QAPI team, then you can invite them to participate in a PIP on sort of an ad hoc or as needed basis. Chartering implies that the team has been entrusted with a mission, and that it reports back to the steering committee, the QAPI committee, whatever you call it, at regular intervals. So use the goal-setting worksheet found on the CMS website to help your PIP team establish appropriate goals for organizational quality measures, internal improvement initiatives, and PIPs. Okay. Careful planning of PIPs includes identifying areas to work on through your comprehensive data review. It is important to focus your PIPs by defining the scope so that it become too big and overwhelming, right? You and your team may consider each PIP a learning process, determine the information you need for the PIP, develop a timeline, and then regular communication back to the QAPI committee or steering committee. Identify anything you need to accomplish the PIP, supplies, materials, time, things like that. Prepare and present results. And also, I'm sorry, I skipped that. Create measurement tools as needed, and then prepare and present results. And you can also use a problem-solving model like PDSA, plan, do, study, and act. And then finally, you report the results back to your steering committee. In just a moment, Andrea will go into detail about tips for cardiovascular health, including examples of expected outcomes, actions, and interventions. We'll get to that in just a minute. But I just wanted to spend just a minute or so talking about PDSA, or Plan, Do, Study, and Act. I'm sure many of you have seen this before. This is a standard QAPI technique or tool where we look at, we plan for something, we do it, we study the outcomes, and then we act. And that cycle can be followed in a kind of a circular pattern as needed until you've worked out the particular issue that you're working on. So be aware, in looking at PDSA, be aware of how each phase works and is connected to the other. Okay, these phases should not work independently. So you don't take just one and then not the others and just say, okay, I've done that, and you move on. You have to use all four components, and they're all interdependent. One common problem is getting stuck in the planning phase, or analysis paralysis, spending too much time analyzing the problem, where we can't move that on to do, study, and act. Okay. Some organizations use parts of the PDSA, such as plan, and never take the process further. Some only plan and do. And this is common as you have a lot of responsibilities, and there's a tendency to just do something to address a problem and then cross it off the list. Now, again, some of the smaller problems that you might encounter in your QAPI plan might simply require not much intervention. That you might want to plan and do something, but it always is important to study what the results are and then act on those outcomes. So if it's a small intervention that you've done, you've planned, you've done, you studied it, it's come out good, and it's working well, the act would be then, okay, we solved that problem, we move on to the next one, okay? But looking at when you're chartering PIPs and doing performance improvement plans, it's important to use the PDSA cycle and use those four areas fully. Okay. A major challenge in process improvement is getting to the heart of the problem or the opportunity. Okay, it can be risky to start with a solution without thoroughly exploring the problem. Multiple factors might have contributed to the problem and may be a symptom of a larger issue. So what seems like a simple issue may involve a number of departments and a number of people and a number of processes. Root cause analysis, or RCA, is a term used to describe a systematic process for identifying contributing causal factors that underlie variations in performance. Okay, it is designed to get to the underlying cause of a problem, which then leads to identification of effective interventions that can be implemented in order to make improvements. Okay, RCA helps teams understand that the most immediate or seemingly obvious reason for a problem or event may not be the real reason that event occurred. The RCA process leads to digging deeper and deeper, looking for the reasons behind the reasons. This process will generally lead to the identification of more than one root cause. The root causes and any contributing factors can then be sorted into categories to facilitate the identification of various actions that can be taken to make improvements. So, RCA root cause analysis focuses on systems and processes, not individual performance. And I think that's an important thing when you're moving forward with your QAPI plan, to let your staff know as part of the communication process that by looking at issues in your agency or developing a performance improvement plan, you are not looking at individual performance. You're not looking at, it's not a punitive that process. It is a learning process, so it focuses on symptoms and processes. There's not a blame factor involved in this. So the RCA process takes practice, but can be a valuable tool for performance improvement. So in order to get familiar with RCA, root cause analysis, you and your team may consider studying case examples of root cause analysis. Any will do, but if you can find some that might be particularly relevant to home health agencies, that would be great. Apply root cause analysis to an adverse event and discuss this technique with the team. So use RCA and try to discuss, how that on an adverse event that occurred in your agency, and use that as a learning tool, and build root cause analysis examples into training opportunities. And I think now I'm going to turn it over to Andrea, who's going to talk about how to take systemic action.
Thanks, Mark. So I'm going to cover the last action step into creating your QAPI plan, and that is taking systematic action. As Mark was talking about identifying root causes, that's really only your first step in improving performance in your agency. Once you do that, you're going to want to implement changes or corrective actions that are going to result in improvement, or they could reduce the chance of that event happening again. So that is often the most challenging step in this process. Some common solutions, such as providing more training or education, or asking your clinicians to just be more careful, does not necessarily change any processes or systems. Choosing the actions that are tightly linked to root causes and that lead to a system or process change are more likely to be effective. So actions that simply support your current processes are going to be considered weaker. So those are actions that you shouldn't select as your only intervention. The goal is to really make changes that are going to result in lasting improvement. And you'll want to avoid quick fixes and weak actions. So to be effective, interventions or corrective actions should target the elimination of those root causes that you identify, and they should offer long-term solutions to your problem, and those will have a greater positive than negative impact on your processes. And also your interventions must also be achievable, objective, and measurable. So we've already talked about the concept of QAPI. We've introduced you to that. We've talked about the 5 standards for home health agencies, and we've given you some action steps to developing a QAPI plan. So what we're going to talk about next is where the Home Health Cardiovascular Data Registry, or HHCDR, comes into play. So the HHCDR was created by the Home Health Cardiovascular Improvement Initiative, or HHQI, and it aligns with the Million Hearts Initiative, which focuses on the ABCSs of preventative cardiovascular care. So those are aspirin when appropriate, blood pressure control, cholesterol management, and smoking cessation. So the HHCDR provides you with free data reports that you can use, and it helps you to identify trends in this area, also patterns, and potential areas for improvement or opportunities. And the HHCDR gives you a monthly data report, which is created by the ABCS measure data that you enter into the registry. So in a minute, we're going to cover some suggested interventions or resources that you can use as part of your PIT related to any cardiovascular areas you want to focus on. We'll look at each measure. But before you implement a PIT, there's a few things that you'll want to do, and you'll want to review each of the applicable ABCS sections to identify any specific opportunities or barriers in your agency. You'll want to talk about other potential opportunities or barriers with your team and determine which of those opportunities or barriers you want to address as part of your QAPI PIT. You can use the suggested interventions and resources, and that is really a great way to jumpstart your brainstorming surrounding your QAPI plan. You might need to perform additional assessments, maybe looking at your process flow. You can look at observations, chart audits. You could interview staff or also your patients. So those are just some ways that you can assess what's currently happening in your agency. And then once you've done that, you want to consolidate and prioritize your interventions and your resources. So identifying areas where you want to focus based on the data that you've collected. And once you've done those steps, you want to write your initial PIT and then also include that rapid cycle PDSA that Mark talked about. So revisiting it every so often. Evaluating, monitoring, and modifying your plan as necessary. So this slide outlines the ABCS measures and what each measure is evaluating within the cardiovascular data registry. And I won't go through them in detail, but the next few slides can assist your organization with assessment and planning for a cardiovascular health PIP as it relates to your QAPI plan. So this is going to give you an overview that can help you to identify potential areas that you might need improvement for cardiovascular health within your agency. So you can check out HHAs PIT tool for cardiovascular health for more information. They have some really great resources out there. And next I'm going to be talking about some expected outcome examples. So this would be part of your performance improvement plan. And also I'll give you some actions and interventions that you can implement as part of a PIT. So we're going to start first by looking at aspirin. So what I have here on this slide is the question as it would show in the HHCDR. So the question is, did the patient take aspirin or another antithrombotic during this episode of care? So what you would expect to see as you enter data into the registry for this aspirin measure, you would hope to see an increase in compliance of your patients with ischemic vascular disease, taking in aspirin or other antithrombotics as an evidence-based intervention unless contraindicated for this patient. So what you would expect to see is a percentage increase from your baseline. So you would determine what date you wanted to start entering data on, and after you've implemented an intervention, you would expect to see an increase from your baseline. So here are some suggested interventions related to the aspirin measure. Some things that you could do would be to educate clinicians on cardiovascular preventative guidelines with aspirin or other antithrombotics. So here you want to look at who is benefiting from taking aspirin to prevent cardiovascular disease. Looking at risk factors for men and women and how you determine harm versus benefit for whether it's beneficial for the patient to be put on an aspirin or antithrombotic. And then also you could communicate with your patient's primary care practitioner to confirm their plan of care related to taking aspirin or other antithrombotics. So for this action, you could use the cardiovascular health communication fact sheet. So that would give you or request information from your patient's primary care provider. So it's just a great way to stay in constant communication with your patient's primary care practitioner to get information that you might need for this measure. You could also use the SBAR technique, and SBAR stands for Situation, Background, Assessment, and Recommendation. And that's an effective and efficient way to communicate important information between providers. So it's just giving you a simple way to standardize your communication and also allowing both parties to have common expectations related to what's supposed to be communicated, and how that communication is structured. Go back. You can also provide your patients with health literate and meaningful education materials related to preventive aspirin use if that applies to that patient. So some of these items could be brochures on taking aspirin to prevent heart attack, and you can use those that are gender specific, so men versus women, and you can also provide them with a medication schedule, and utilizing the take-back method is another great way to communicate that with your patients. Next, we're going to be looking at the blood pressure measure, and there are two questions you abstract from the HHCDR. The first is documenting when the last blood pressure was recorded during that episode of care. And the next question is, was there a follow-up plan to obtain a better blood pressure control included in the record during this episode of care? So what you would expect to see by inputting the blood pressure measure into the registry would be an increase in compliance of your patients with a diagnosis of hypertension, being discharged with a blood pressure that was adequately controlled, and again, that's an increased percentage from your baseline. And then also an increased number of patients who received a documented blood pressure follow-up plan. So some suggested areas for improvement surrounding the blood pressure measure would be confirming that all of your staff are accurately assessing blood pressure on every visit. So it's providing your patients or for your staff to have the proper training that they might need, or education and competency testing, making sure that all disciplines are taking blood pressures, including your aides, and also using the right equipment, so making sure it's the right size, that your equipment is regularly calibrated and cleaned properly. Also educating staff on current guidelines and evidence-based strategies. So just a few recommendations that we have here would be recommending lifestyle modifications. That could be weight reduction for your patients. They could utilize the DASH eating plan, and what that is it stands for Dietary Approaches to Stop Hypertension. Providing patients with dietary sodium reduction education on physical activity, modification of alcohol, smoking cessation, and also antihypertensive medication management information. And it's also important here to utilize patient self-management principles. So really giving your patients the right materials that they are able to manage their blood pressure on their own. So any medication management tools that they might find useful, some strategies to eliminate adherence barriers. They can also do self-monitoring of their blood pressure with an automated cuff. There is some strong evidence that using this technique would lower patients' blood pressures, and then providing them all of this information with health literate material. And then also you want to ensure that every patient is receiving adequate number of visits from managed care organizations. So you can, again, use an agency worksheet that could include recorded blood pressure reading, what the primary care physician's blood pressure goals for that patient are there any barriers with medications or lifestyle modifications that this patient has encountered, what education you've already provided that patient, and what other additional educational needs they might have, and what their progress is towards patient self-management. And you can also, again, use the SBAR format if it's possible. That's a great way to be concise, thorough, and consistent with your communication. So for the cholesterol measure within the HHCDR, there are a few questions that are asked here. The first is if there is a documentation in the medical record that the patient received a cholesterol screening within the past 12 months prior to their discharge date. And if yes, you would indicate what the results were in the patient record and provide the LDL value and date if you have it available. So what you would expect to see here by inputting this measure is an increase in compliance of your patients diagnosed with ischemic vascular disease or diabetes with normal or improved cholesterol levels. Again, an increase, a percentage increase from your baseline with this data. So some interventions that you could use for the cholesterol measure would be identifying patients who are at high risk for cholesterol. So those would be patients with ischemic vascular disease or diabetes. Those are going to be your highest risk populations. And then also communicating with primary care practitioners using the fact sheet that I already mentioned, or you can use the questions about my heart health or my doctor tool that could be for patients to obtain their own levels so they can be better self-managers in their care. And also ensuring that staff are practicing or using the current guidelines and implementing only evidence-based strategies. So some examples here would be through the American College of Cardiology or the American Heart Association guidelines, therapeutic lifestyle modifications, and then also cholesterol-lowering medications. And again, here you want to make sure you're providing patients with health-literate material and meaningful education related to lowering cholesterol levels. That could be helping them interpret their lab values and also to help them track their cholesterol levels. You can give them education on therapeutic lifestyle change and also patient adherence and effective management of cholesterol treatment. And the last measure of the HHAs is smoking cessation. So that asks two questions within the registry, and that is, during this episode of care, was the patient screened for tobacco use by the organization? So if you select yes, you would answer if the patient was identified as a current tobacco user, if they received tobacco cessation counseling or an intervention by your organization. So what you would expect to see here with this measure is an increase in compliance of tobacco-using patients receiving pharmacotherapy, or at least 3 minutes of cessation behavioral counseling. And again, a percentage increase from your baseline would be expected here. So some tips for the smoking cessation measure would be to complete a comprehensive tobacco assessment beyond what's already in your OASIS system for your risk factors. What you want to include here is any tobacco exposure, so that could be cigarettes, cigars, chewing tobacco, e-cigarettes, and secondhand smoke exposure too. And you want to look at the frequency. So, for example, if they're smoking cigarettes, you want to look at packs per day, could be an example. And also you want to evaluate their history of tobacco use. And within this assessment, you want to note any quit attempts that the patient has already attempted, what their methods were at quitting, and what successes or barriers have they had. And again, you'll see that you'll want to communicate with the primary care practitioner on the patient's willingness and readiness for cessation. So communication between the primary care provider is really key to getting this information and getting the right care for your patient. And then you can also offer cessation education for all clinicians. That could be behavioral counseling. They could do pharmacotherapy. So you could educate them on first-line medications, such as nicotine replacement therapy. And then also providing your patients with health-literate and meaningful education related to tobacco cessation. So you can provide them with patient dependency self-assessment or a tobacco use log so they can document how much tobacco they are currently using, providing them information on what the effects of tobacco are, specifically on the cardiovascular system, and then also giving them quit strategies is helpful as well. So we're going to do one last polling question, and it should pop up soon in your on your screen. And our question is, do you plan to use the HHCDR or the Home Health Cardiovascular Data Registry as part of your QAPI plan? And if you answer yes, feel free to share any ideas that you have or how you're going to utilize the registry as part of your QAPI plan in the chat. We'll give it a few seconds for the polling question to come up. And the polling question should be up on your screen now. Again, the question is, do you plan to use the HHCDR as part of your QAPI plan. So we'll give you just a few minutes to answer that question. And again, I don't have hold music either for Jeopardy music for you guys.
Every time I sing, my wife tells me to shut up, so.
We will spare you guys the torture of
yes.
singing. The results should pop up in just a second. All right, so it looks like a few of you plan to use the data from the HHCDR as part of your QAPI plan, so eight of you, and a couple of you are probably focusing on another area, but that's okay too. So good. I'm good to see that a few of you are already going to use that as part of your QAPI plan. I did want to mention really quickly some resources that are available if you don't know about them already through the Home Health Quality Improvement, or HHQI, campaign. They do have PIP tools on their website related to cardiovascular health, hospitalizations, and medication management. So there are those available for you to use. And also their DPIP, or Best Practice Intervention Packages. There are a few related to multiple focus areas such as diabetes. They do have obviously a cardiovascular health one on there, immunization. They also have a QAPI course if you wanted to learn more. It's on their HHQI University website, and I believe there are nursing CEs offered for that course, and you can take it at your pace whenever you want. So I just wanted to make you aware of those resources that are out there. So at this time, we're going to pull up the evaluation questions. So if you could just take a moment to let us know how we did by filling those evaluation questions out. And those should pop up on your screen. And we will open it up for Q&A. Operator, can we open the line for some Q&A?
Certainly, ladies and gentlemen. If you have any questions at this time, please press the number 1 key on your phone. Again, if you have any questions at this time, please press the number 1 key on your phone.
And I did already receive a few questions in the chat, just that if the PowerPoint will be available after the webinar, we will be posting it to our LSQIN YouTube page. So I will send the link to our YouTube page in just a second, but it will be available on there. And also, Part 1 is available on our YouTube page currently. So if you did miss the first session, feel free to check that out on our YouTube page as well.
We have no questions at this time.
All right. I did receive another question in the chat. That you have to focus on all 4 measures as part of QAPI or your QAPI plan. The answer to that would be no. You can focus on 1 measure at a time. I would say you can collect all data on all 4 measures at that time, but you don't have to focus on all 4 as part of your QAPI plan. So what I would suggest would be to start with about 2 measures. And I did get that question. Which measures would you start with? I would start with blood pressure and smoking cessation, because those 2 measures will focus on the whole body system. And I would recommend starting with those 2 and starting with a baseline, collect baseline data. You can also collect past data. You can go back as far as July 2014 in the HHCDR, but I would recommend going back about 3 to 6 months before you implement an intervention. And then after you implement your intervention, you can see if there is any trending within those 2 measures. So that would be my personal recommendation.
Yeah, and it's good to start this. I think the HHQI data registry is a great place to start because the data is there for you to utilize. You don't have to go searching for the data. It's there, As Andrea said, the blood pressure control and smoking cessation deal with the systemic body issues, for the entire body. And I think it's just a good way to start a QAPI plan. And then you can move into other areas, other systems in your organization as you move forward from there. But it's a good place to start. Remember, go for the win early, and the data provided to you it can be very valuable.
And for those of you who missed part 1, we do have the YouTube link within the chat. And I did receive another question in the chat. How do you access the HHQI data registry? I will put a link to the HHQI webpage in the chat, and I can explain that really quickly on how you can access it. Give me just 1 second. So in the chat, I put the Home Health Quality Initiative webpage, and in order to access the data registry, you will need to click on the Cardiovascular Health tab, and there will be a section that says Data Registry, and you'll click on that. There will be a small box on the right side of your screen that says click here to register on HHQI data access, and if you click on that, it will take you to another web page, and if you're not currently registered, you will need to sign up. You'll need to have your agency's CCN number on hand, and there will be step-by-step instructions on how to become a data administrator. And if you need any assistance with that, I can put my contact information in the chat, and I would be more than happy to help you get signed up with that.
Yeah, Andrea's helped many agencies sign up for the registry and access their data.
Yeah, and from the feedback I've heard, it is fairly simple once you get the hang of it on inputting your data into the registry. And there is one other question in the chat. Can I get a copy of the slides from the event? So if you go to the QualityNet event page, and if you enter the password HHA QAPI in all caps and no spaces, and scroll down to closer to the bottom of the page, that's where you'll see where you can enter the password and you can access those slides. And I'll put the link in the chat again.
Do we have any other questions from participants?
I have no questions at this time.
Well, thank you so much. I think Andrea's got a couple of announcements to make, and then we'll send you on your way.
I did get one other question. The slides for part 1, I can put my contact information in, and if you just want to email me, I can email them to you. The recording is on our YouTube page, but if you do want just a copy of the actual slides, I can make sure I can email them to you, and I'll put my contact information into the chat. So my email is in the chat. If you do have any other questions, just feel free to reach out to me. I just wanted to thank everyone for joining us today for part 2. Like I said, the webinar will be recorded, and it's available on our YouTube page probably within the next week. And I've put the YouTube link in the chat. And also next week, we have a webinar on transfer in-person and family engagement. So that's next Tuesday, February 2nd at 3 p.m. So the purpose of that session is to prepare healthcare quality improvement professionals to implement person-centered care strategies by exploring promising practices for identification of what matters most to each and every patient, regardless of care provider, setting, and time. So I can send you a link to that event also in the chat. And again, I just wanted to thank everyone for joining us today. Operator, could you tell me if we have any final questions on the queue?
No, we have no questions waiting at this time.
Thank you for your help today.
All right, thank you.
Yes, thanks everyone, and have a great day. Just a thought, if you guys need some help with your QAPI plan too, Andrea and I would be more than glad. You can contact Andrea at her email there, and she and I could provide some help assistance to you in kind of negotiating that if you need some help with that. So we thank you for attending today.
Thank you, everyone. Have a great day.
Ladies and gentlemen, this concludes your call. You may all disconnect your lines.